Hello, everyone, and welcome to Question Lab. We're happy to have you here today as we discuss the topic of reproductive. Leading our discussion today is Dr. Paras Vakaria, and he's going to introduce himself to you now. Paras.
Thank you, Sean. Hey guys, my name is Paras. I am a dermatology resident here in Dallas, Texas. I originally graduated from pharmacy school and then went back home to do medical school. I also work as an RX coach with USMLE-Rx, so I work one-on-one with students such as yourself to help prepare you guys for the USMLE Step 1 and Step 2 CK as well. And I'm happy to help lead tonight's session.
I spoke briefly earlier about RX Coach. We'll talk more about it later. RX Coach is our one-on-one coaching and tutoring program, and we work with you individually to help you accomplish your goals. What you should know for now, though, is the methodology that we will employ as we dissect these 4 questions is going to be the same methodology that we use in RX Coach. So with that, let's go ahead and get into our first question of the evening. As you can see, the answer choices are covered up. That is by design. We do that because we don't want the answer choices to guide or dictate your thought process. We don't want you to see an answer choice that you're unfamiliar with that may cause you to panic as you're trying to answer the question on test day. So I've gone ahead and covered those up. After that, we begin with the lead-in. The lead-in is the last sentence of the question itself. And the reason we do that is because we want you to know what the test writer is asking before you read that vignette so that you can pick up on all those relevant clues and not have to waste valuable time on test day rereading that question. So let's do that now. Rupture of which of the following structures is most likely the source of injury in this patient? Rupture of which of the following structures is most likely the source of injury in this patient? After that, we'd like to ask our students how many steps they believe this question will require. An example of a 1-step question could be where you're asked for the diagnosis. An example of a 2-step question could be when you're ready, asked for the treatment for a diagnosis. And the third example of a 3-step question could be where you're asked for the mechanism of action for a treatment for a diagnosis. So please let us know in the question box how many steps you believe the question will require, and then we'll move on to that vignette. All right, I see the responses coming in. Let's take a look at that vignette. A 15-year-old boy is brought to the emergency department with severe groin pain. The patient was riding a skateboard down a horizontal rail when the skateboard slipped. The patient subsequently fell and straddled the railing. Physical examination reveals tachycardia and inability to void. Genital examination is significant for blood at the urethral meatus, and there is marked bilateral scrotal swelling. Rupture of which of the following structures is most likely the source of injury in this patient? Paras.
Thank you, Sean. So what we're going to do is we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. And so generally starting off, the first thing you're usually going to get in clinical questions are demographics. And in this case, we're told it's a 15-year-old boy. So you generally want to make note of those demographics because that can automatically start to clue you in on what you should be thinking about. And then they usually tell you, why are they coming into the ER? Why are they coming into the hospital? In this case, it's because of severe groin pain. So you definitely want to make note of that. What is their presenting signs and symptoms? Okay. Sometimes they'll also tell you chronicity. Has this been going on since yesterday? Has this been going on for a few months? Okay, so you also would want to make note of that if they tell you that as well. Now we do know that there's some important history there, about this injury, and then we're given some significant physical exam findings as well as genital exam findings specifically. So then this question specifically is asking us about a structure that was ruptured, or most likely ruptured, and that is the source of injury in this patient. So I think we've got to figure out a couple things here. I think we've got to figure out, one, what is the type of injury or issue going on in this patient? And then 2, what structure may have been ruptured most likely? So I think we've got a nice 2-step question here. So let's go ahead and let's take a look at those answer choices. What we see here are 5 answer choices. And when we work with students, we recommend that when you go through answer choices that you actually start at the bottom and then work your way up to the top. So start with answer choice E and then work your way up to answer choice A. The reason we do this is because sometimes we'll see students who, they'll start at the top, they'll see something they like, and they'll select it without having gone through all the answer choices. So sometimes they'll get that question wrong. So to prevent yourself from making that mistake and prevent yourself from biasing yourselves, we recommend doing it this way. So let's go ahead and do that now. Answer choice E, prostatic urethra. D, penile urethra. C, membranous urethra. B, bulbous urethra. And A, anterior bladder wall. So we're going to go ahead and open up the poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Thank you very much, Boris. As you can see, the poll is open. We'll wait until about 2/3 of you have responded again before we go over the correct and incorrect answers. Remember that on test day, there is no penalty for guessing, and certainly not tonight. So if you're unsure, don't worry. Take your best guess, and we'll review it together shortly. I see the responses coming in. We'll give all of you a few more seconds. All right. Well, let's take a look and see what you selected. 41% of you selected membranous urethra, 28% of you selected bulbous urethra, and third place was a tie with fourth place for penile urethra and prostatic urethra. So let's see what the correct answer is. And the correct answer is B, bulbous urethra, and 28% of you got it right. So definitely a challenging question. Let me hand it off to Paris.
Thank you, Sean. Yes, definitely a tough question. So let's take a look at what's going on here in this patient. So we have a 15-year-old boy who essentially has a straddle injury, okay? You see this in people who are gymnasts, who ride bicycles or skateboards, okay? And what can happen is in males, it can lead to crushing injuries of the urethra, okay? Now, if we take a look at the next slide, you can see there some of those common GU traumas that can be experienced, okay? And usually it can present with blood at the urethral meatus and difficulty voiding, like our patient, okay? Now this patient had a straddle injury, and as you can see there in that first aid table, this is likely going to result in an anterior urethral injury, essentially disruption of the bulbar or spongy urethra, okay? And this can lead to a hematoma in the scrotum. Remember, our patient did have marked bilateral scrotal swelling, okay? So this is most likely what is happening in our patient, okay? Now, if you were to have a membranous urethra disruption, that would be more so from something like a pelvic fracture, okay? And urine could leak into the space behind the pubis, okay? So a little bit different here. So hopefully you guys are seeing why the way that this patient fell, specifically talking about how it's a straddle injury, really can help you come to the correct diagnosis here. So if we take a look back at our question and vignette, and don't worry, there's still an image there showing the different types of urethra segments. If you were to worry about a prostatic urethral rupture, those are actually pretty rare, okay? That can be if you were putting in a catheter wrong or the pelvis broke, but as you can see there, that's kind of very close to the bladder, and it's kind of well protected by that prostate. The penile urethra, that could be damaged following a penetrating injury, so something that penetrated into the urethra distally. We talked a little bit about a membranous urethral damage. And that can be caused by bladder rupture, that can be caused by pelvic fracture, as we talked about. But you would have different signs and symptoms, like we talked about, a high-riding prostate, a fluid collection behind the pubic space. And then lastly, anterior bladder wall. A rupture of this would typically be caused by a fractured pelvis, and again, urine would flow into the retropubic space, which is not what we're seeing here. So the clinical presentation fits best with the bulbous urethral injury, which we know is very high risk with straddle injuries.
Well, thank you very much, Paris. Definitely a challenging question, and hopefully that explanation helped you master it for next time. Let's move on now to our second question of the evening. Once again, the answer choices have been removed. That is by design, and we will begin with the lead-in. Which of the following is the most likely cause of this patient's condition? Which of the following is the most likely cause of this patient's condition? I'll give all of you a few moments here to respond in the question box and let me know how many steps you believe this question will require. Then we'll read that vignette. All right, I see some responses coming in. So let's go ahead and take a look at that vignette. A 27-year-old male presents to the clinic with tender bumps in his groin for the past 2 days. He had unprotected intercourse with both men and women while on vacation in the Caribbean 1 month ago. He recently noticed small painless ulcer on his penis, which resolved on his own. Physical examination reveals bilateral, tender, inguinal lymphadenopathy with 2-centimeter overlying ulcerations. Which of the following is the most likely cause of this patient's condition? Boris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. So now we've got a 27-year-old male, and they tell us he's coming in because of tender bumps in his groin, okay? And they also give us a little bit of a time frame as to how long it's been going on. So you definitely want to make note of that, okay? They give us some important social history there, and then importantly, some very important physical exam findings, okay? So you want to use all those clues and gather them up to help come up with what you think is the correct answer here, okay? Now in this question, they're specifically asking us about the most likely cause of this condition. So I think we've got a nice two-step question. I think one, we've got to figure out what the condition is, and then two, what is the most likely cause of that condition? So let's go ahead and let's take a look at those answer choices. Once again, we are going to start at the bottom, and we are going to work our way up to the top. Answer choice E, Treponema pallidum. D, Klebsiella granulomatous. C, herpes simplex virus. B, Haemophilus ducreyi. And A, Chlamydia trachomatis. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Well, thank you very much, Boris. Once again, the poll is open, and we'll wait until about 2/3 of you have responded. As always, we do have a raffle and special offer at the end, so make sure you stick around. You might be our lucky winner tonight. We'll give all of you a few more seconds here. All right, well, let's take a look and see what you selected. 41% of you selected Treponema pallidum, and in second place, we had chlamydia. So let's take a look and see what the correct answer is. And the correct answer is A, chlamydia, and 21% of you got it right. So another challenging question. Let me hand it off to Boris.
Thank you, Sean. Yes, definitely another tough question here, but very important differential to talk about. So as you can see here, this is kind of in that differential of what we would call ulcerative lesions in the genital region, okay? This patient does have a small painless ulcer on the penis. So important things that you want to be on the lookout for, important clues. Is it painful or painless? In this case, we are told that it is painless. We're also told that the ulcer resolved on its own. Some ulcers don't resolve, some ulcers do. We'll talk about that. But then also, is there anything else in that groin region? In this case, we're told about bilateral lymphadenopathy. That's almost 2 centimeters large. Okay, that's pretty big. So what is going on in this patient? Well, this patient likely has lymphogranuloma venereum, okay, LGV. And this is due to chlamydia trachomatis serotypes L1 to L3, okay? If we take a look at the next slide, you can see a little bit about there. If you look at about halfway down, you can see that lymphogranuloma venereum. You can see that they have painless genital ulcers, but they do have what are called buboes, or enlarged lymphatics, lymphadenopathy. Okay. Another thing about this infection is it's common in the tropical and subtropic region. We know this patient traveled to the Caribbean. Okay. These lymph nodes often ulcerate as well. And one of the nice signs of this we'll talk about when we go back. But since we have these other sexually transmitted infections, let's take a look at these because these are the other answer choices there. So Treponema pallidum, this is the causative agent of syphilis. Now remember, this can also present as a painless ulcer or chancre, okay? But you shouldn't have lymphadenopathy in primary syphilis, okay? And they shouldn't be primarily just in the groin. They would kind of be all over systemically. Patients would also, in that case, have a fever. They would have a rash, okay? So other things that this patient does not have that would make us want to go with syphilis, okay? Chancroid, that is a painful genital ulcer. Our patient's was painless, okay? You can have inguinal adenopathy, but what pushes against that is the fact that in that condition, it's painful, okay? Herpes simplex virus or herpes genitalis. This is also, you can get usually more so vesicles that then open and become ulcers, but they're usually painful, okay? And in this case, we're told that they're painless. And lastly, granuloma inguinal, which is caused by Klebsiella granulomatous. Again, it can be an ulcer that is painless, okay? But it usually is, they say beefy red because it can bleed a lot, okay? And you also wouldn't have adenopathy or inguinal lymphadenopathy. That would be uncommon in that condition. So as you can see, if we go back to our question in our vignette, all of those clues in that question actually were very important. Where he was a month ago, the fact that the ulcer was painless, that there was inguinal lymphadenopathy, okay? And that suggests a diagnosis of lymphogranuloma venereum. So some very subtle clues that point you to the right condition and can kind of help rule out other conditions. A tough question, but definitely points to how important it is to pick up on those clues in the vignette.
Well, thank you very much, Boris. Great explanation there. Let's talk briefly about RX codes. So, if you're studying for your board exams or a comp exam, what we'll do is we'll start you with an assessment. If you're studying for in-school exams, we'll look at your syllabus and learning objectives. So what do? Well, we work with you one-on-one to help you accomplish your goals. So if you're one of those students that says, I'm studying, but my efforts really aren't matching my results, I'm spending more time than I should be, I'm not making progress, or I'm doing great, I want to do better. Whatever your situation is, we can help you elevate your game and help you maximize your potential on test day. We work with you one-on-one to help identify and bridge your knowledge gaps, work on your test-taking skills, create a personalized study plan for you. And our coaches like Brenda and Faros are very, very highly trained, and they're all certified. All of our packages do include access to all of our resources, and we have a lot of wonderful success stories with some students even increasing as much as 80 or 90 points on their board exams. So if you're interested in working with one of our coaches, reach out to us at rx-coach.com. rx-coach or -coach You can schedule a free consultation there. And what we'll do is we'll talk about the coaching program and how it can benefit you to see if it's a good fit. So if you want to talk about that program, like I said, that consultation is absolutely free, and you can sign up at rx-coach.com. So with that, let's go ahead and get into our third question of the evening. As you can see, the answer choices have been removed. That is by design, and we will begin with the lead-in. Which of the following diagnoses is most likely? Which of the following diagnoses is most likely? I will give all of you a few moments to respond in the question box and let us know how many steps you believe the question will require. And then we'll read that vignette. All right, I see some responses coming in. We'll give all of you a couple more seconds here. All right, let's go ahead and take a look at that vignette. A 24-year-old man presents to his family physician with lower abdominal and diffuse pelvic pain, fevers, and urgency and burning during urination for 3 days. 2 weeks earlier, he was hospitalized for 1 week after a motor vehicle accident, leading to 4 days of chronic Foley catheterization. His temperature is 38.6 Celsius, or 101.4 Fahrenheit, and he is in extreme distress due to pain. He refuses an abdominal or genital urinary examination due to his severe pain. Complete blood count shows a white blood cell count of 14,600. Urinalysis reveals white blood cells and bacteria with no casts. Which of the following diagnoses is most likely? Boris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. And so now we've got a 24-year-old man, and he's coming in because of a few signs and symptoms. Lower abdominal pain, diffuse pelvic pain, fevers, urgency, and burning during urination. So a lot of presenting signs and symptoms. But you definitely want to take note of all of those because you may have to kind of combine them to come up with what's going on here. We're also told about how long it's going on. It's been going on for 3 days, so you definitely want to make note of that. We are given some earlier medical history, okay, some vital signs, and also some laboratory signs, okay, findings. So you definitely want to make note of that. You definitely are going to have to piece all these puzzle pieces together and figure out what's going on, because this question is asking us specifically about a most likely diagnosis. So it's probably just a one-step question, but that means we're going to have to use all those clues and really make sure that we're picking up on what's going on to come up with that right diagnosis. So let's go ahead and let's do that now. Let's take a look at those answer choices. Answer choice E, urethritis, D, pyelonephritis, C, cystitis, B, appendicitis, and A, acute prostatitis. So we'll stay on this slide for just a second so you guys can take another look at those, at that vignette. And then we'll go ahead and open up that poll.
All right, the poll is open. Please select your response, and then we'll move on to our last question, and of course, our raffle and special offer. Next week's topic is microbiology, and we hope you'll join us then. All right, a few more seconds here. All right, let's take a look and see what all of you selected. It was close. 36% of you selected cystitis and 28% of you selected pyelonephritis. So let's take a look and see what the correct answer is. And the correct answer is A, acute prostatitis. So definitely a challenging question. Let me hand it off to Boris.
Thank you, Sean. Yes, definitely another tough question. So what's going on here in this question? So what are those important clues? Well, we know that this patient has an elevated white blood cell count, okay? Also has a fever, okay? It also has white blood cells and bacteria in the urine. Okay, so there are a few things here. However, this patient also has really bad pain, really bad abdominal pain, okay, and pelvic pain. So that kind of makes it unlikely that it would be plain cystitis, okay? And in men, febrile urinary tract infections are either due to pyelonephritis or acute prostatitis, okay? Now, this patient does not have any flank pain or any flank tenderness, okay? But the other thing that's important there is there's no casts in the urine. A patient with pyelonephritis may possibly have white blood cell casts because the infection is higher up in the kidney. Okay? If we take a look at the next slide, this is kind of a tidbit on prostatitis from first aid. Okay? And you can see there that these patients often have dysuria, frequency and urgency, like our patient, but also have back pain. Okay? Oftentimes, if you were to do a prostate exam, you could feel a boggy or enlarged prostate. And in an acute prostatitis infection, usually in older males, it's due to E. coli. In younger males, it could be due to chlamydia trachomatis or Neisseria gonorrhea. Okay. So in this case, it's more likely that this would be acute prostatitis. There's a couple things that point away from pyelonephritis. But let's take a look at those other answer choices. Let's go through those. So urethritis, urethritis could present with dysuria and white blood cell counts, but not with back pain. You wouldn't have back pain and you wouldn't really have a fever. We'll come back to pyelonephritis. Cystitis, like we said, that's just a simple UTI with dysuria, but you shouldn't have a fever, leukocytosis, or that severe pain. Appendicitis, you can have fever, you can have leukocytosis. Your pain would kind of be, in theory, isolated to the right lower quadrant, and that wouldn't necessarily explain the urinalysis findings. Lastly, pyelonephritis. Pyelonephritis can present with leukocytosis, with fever, and with white blood cells in the urine, what we call pyuria. But we would want to see white blood cell casts in that situation, indicating a higher infection. Okay? So in this case, it's a tough question, but the better answer choice here is probably acute prostatitis.
Well, thank you very much, Boris. Great job, everyone. Let's move on now to our last question of the evening, and let's try to finish strong. Once again, and as always, we'll begin with that lead-in. Which of the following additional findings is most likely in this patient? Which of the following additional findings is most likely in this patient? I'll give all of you a few moments here to respond in the question box and let me know how many steps you believe this question will require, and we'll read that vignette. All right, I see the responses coming in. Let's take a look at that vignette. A 17-year-old girl presents to the physician because the patient has not begun menstruating. On examination, the patient has a blind end vagina without a cervix. The patient has two small masses in the labia majora. Serum studies show an elevated serum testosterone level. Which of the following additional findings is most likely in this patient? Boris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. And so this is our fourth time doing this, so hopefully you guys are, also picking up on what are those important clues to come to the correct answer of these questions. So we'll go ahead and do that for this question. A little bit of a shorter question now. We're told that now we have a 17-year-old girl. This patient has coming in because she has not began menstruating. We are given some important physical exam findings and some serum studies as well. Okay, so we're given a couple important clues there, and hopefully we can use those to figure out what's going on. Because this question is asking us about an additional finding most likely. So what we've got to do, I think, is one, we've got to come up with the most likely condition or diagnosis. And then two, what's an additional finding of that condition? So a two-step question here, most likely. So let's go ahead and let's take a look at those answer choices. Answer choice E, reduced dihydrotestosterone. D, female breast development. C, excess body hair. And B, 47XXY genotype. Sorry, the B, 47XXY genotype, and A, 45XO genotype. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Well, thank you very much, Bart. This is our last question, so let's try to finish strong. And then, of course, we will have our raffle and special offer. All right, see the responses coming in. We'll give all of you a few more seconds here. All right, a few more seconds here. Responses coming in. All right, let's take a look and see what you selected. It was close. 30% of you selected excess body hair and 27% of you selected reduced dihydrotestosterone. So let's take a look and see what the correct answer is. Correct answer is D, female breast development, and 3% of you are right. So let me hand it off to Liz.
Thank you, Sean. Yes, another good question here. So let's take a look at what's going on. Hopefully you guys picked up that this patient has androgen insensitivity syndrome, or AIS. Okay, and basically what's happening is the testosterone receptors are unresponsive to androgens. Okay, so let's take a look at the next slide. Let's dive a little bit into AIS, or androgen insensitivity syndrome. And basically these patients are 46XY. Okay, they're genetically male appearing. Their external genitalia are female, so that's why this patient would have female appearing breasts and breast development. They have a rudimentary vagina, so it is blind ending, meaning there's no cervix, there's no uterus at the apex. Okay, you can see there also the uterus and fallopian tubes are absent. Okay, but these patients have functioning testes. They are 46XY, but these testes are usually found in the labia majora, which is the equivalent of the scrotum. Okay, these patients, as you can see there, have elevated testosterone and estrogen. Our patient did have an elevated testosterone. So if we go back to our question, hopefully you can see now why this is the best answer choice here. So these patients, and in case you may not have read the question correctly, it was asking about an additional finding most likely. So it wasn't saying that female breast development would be absent. It's saying that it would be present, that female breast development would be a finding that we would see in this patient. Okay, so it's always important to read those lead-in questions closely to make sure you're understanding what they're asking. Answer choice E, 5-alpha reductase deficiency would be the condition there, and that means you cannot convert testosterone to DHT, or dihydrotestosterone. And what happens is you do not get embryonic virilization, and so you get ambiguous genitalia until puberty. Okay, at that point, the testosterone does lead to masculine genitalia. Okay, and in this case, we have a 17-year-old who does not have masculine genitalia, so that's probably not the best answer choice. Answer choice C, excess body hair, that would suggest virilization, so more androgen. So if a patient had, let's say, polycystic ovarian syndrome or congenital adrenal hyperplasia, and again, this is not a syndrome due to high androgens, it's actually due to a lack of effective androgens. Answer choice B, this is getting at Klinefelter syndrome. So this is a patient with a male phenotype, but they have a small penis, lack of body hair, and behavioral issues. So not what we have going on here. And lastly, answer choice A, this is getting at Turner syndrome. Obviously, we know about some of those other physical exam findings we'd want to see, such as short stature, lymphedema, amenorrhea, infertility, and you would not have a blind ending vagina as we do have in this patient. So the constellation of physical exam findings here and lab findings points to androgen insensitivity syndrome. So great job with this question. I will hand it back to you, Sean.